Welcome to Emergency Preparedness and Action Plan Training. Presented by Bonneville Labs. The Emergency Action Plan establishes clear responsibilities for performing these functions and ensures continuity of operations so that essential services can continue to be provided. In the event of an emergency, it is crucial that emergency responders and staff are able to perform essential planning and response functions that will save lives and minimize damage. The Emergency Preparedness and Action Plan training covers several important objectives, including a regulatory overview, how to prevent injuries associated with dangerous workplace situations, the fundamentals of an emergency action plan, proper emergency response procedures, and the recognition of various elements of exit routes. By participating in this training, individuals will be better prepared to handle emergency situations and protect themselves, their colleagues, and the community. Cal OSHA regulations require every employer to have an emergency action plan in place. The California Code of Regulations, Title 8, Section 3220 outlines the minimum requirements for an emergency action plan. This training module will cover the information found in the Emergency Preparedness and Action Plan. It is important for employers to comply with these regulations to ensure the safety of employees and the community. If you need a copy of the written Emergency Preparedness and Action Plan, please contact your safety officer. In this training, we will cover various emergency scenarios and the appropriate response procedures. Emergency coordinators, safety officers, and employees will learn how to handle emergency situations, including the use of safety equipment, evacuation procedures, and response to suspicious odors, power outages, spills, explosions, earthquakes, active shooter and workplace violence, fire, and medical emergencies. By learning and understanding these procedures, you will be better prepared to protect yourself and the community in the event of an emergency. It is important to always be aware of potential emergency situations and to know how to respond quickly and effectively. By participating in this training, individuals will be better equipped to handle emergency situations and keep everyone safe. Emergency coordinators and safety officers play a crucial role in ensuring the safety of individuals in the workplace during an emergency. Their responsibilities include coordinating emergency response activities, communicating with others inside and outside of the organization, and performing post-emergency response inspections and evaluations to identify gaps and improve emergency response procedures. They also develop and implement corrective and preventative actions for emergency response activities, provide training on emergency preparedness and procedures, and assist with emergency response for evacuations, injuries, spills, power outages, and other incidents. In addition, emergency coordinators and safety officers are responsible for performing evacuation assembly area roll call and building sweeps as assigned, and reporting incidents for investigation and corrective action. In the event of an emergency, it is crucial to have the appropriate safety equipment readily available. This includes ABC fire extinguishers, located throughout the facility, safety showers and eye wash stations, located in all labs, and first aid kits, located throughout the facility. In case of an emergency involving chemicals or other hazardous materials, it is also important to have spill cleanup kits on hand, including kits for acids, bases, biological materials, and unknown liquids. It is important to note that in the event of an emergency, always flush eyes for 15 minutes and drench the body for 15 minutes using safety shower or eye wash stations. It is also important to keep emergency response equipment free from obstruction at all times to ensure quick and easy access in the event of an emergency. In the event of an emergency, it is crucial to have clear and unobstructed access to emergency exits and equipment. To ensure the safety of individuals in the workplace, it is important to keep main aisles, emergency exits, and emergency equipment clear and free from obstruction at all times. According to the regulations, there must be at least 36 inches of clearance around these areas to allow for easy and safe evacuation. This includes ensuring that exits are not blocked by furniture, equipment, or other materials. In the event of an emergency, it is crucial to evacuate the building as quickly and safely as possible. If it is safe to do so, evacuate to the nearest exit as designated by the illuminated exit sign, when instructed, when you hear the alarm or see strobe lights. When evacuating, it is important to walk, not run, and not to stop to pick up personal items or remove PPE. Individuals should assist those who need help, escort visitors, and proceed to the Evacuation Assembly Area (EAA) and report to the safety officer or designee. It is also important to alert authorities to those who may need assistance or any missing or trapped persons. Stay at the Evacuation Assembly Area until a safety officer gives the all clear. In the event of an emergency evacuation, it is important to know the designated meeting spot, also known as the Evacuation Assembly Area (EAA). All individuals should proceed to the Evacuation Assembly Area after evacuating the building. This includes employees, visitors, and anyone else on the premises at the time of the emergency. At the Evacuation Assembly Area, it is important to report to the safety officer or designee, and to stay at the assembly area until given the all clear by the safety officer. Review your site's evacuation assembly area and emergency evacuation routes. In the event that you or your coworkers detect a suspicious, unknown, or specific odor, or show signs and symptoms of chemical exposure, dizziness, burning eyes, throat, nose, etc., it is important to take immediate action. If you detect a suspicious or unknown odor, or show signs of chemical exposure, immediately evacuate the area and inform your safety officer. Your safety officer will then assess the situation and take appropriate action, which may include activating the emergency response plan, calling for assistance from emergency responders, or shutting down operations. In the event of a power outage, it is important to take appropriate action to ensure the safety of individuals and equipment in the facility. The response to a power outage is determined by the source and duration of the outage. If the power outage is short-lived, the best course of action is to close the sash on the BSC, biological safety cabinet, and fume hood, and turn off equipment in use to place it in a safe state. If the power outage is prolonged, it is important to follow the emergency action plan and contact the appropriate personnel, including the safety officer and emergency responders if necessary. In the event of a spill, it is important to take appropriate action to ensure the safety of individuals and the environment. The procedure for cleaning up a spill will depend on the type of spill and the chemicals involved. If you are uncertain about what to do or are uncomfortable handling the spill, it is important to report the spill to your safety officer. They will be able to determine the appropriate response and provide the necessary resources for the spill cleanup. If you can answer yes to all the following questions, it is safe for you to clean up the spill. Is the NFPA health or reactivity rating less than 4? Is this a small spill, 1 liter or less? Do you know the hazards of the spilled chemical? Do you have all the appropriate cleanup supplies? Can you protect yourself from all the hazards? Do you have all the appropriate resources, assistance, PPE? Are you trained, knowledgeable, and equipped to handle the incident? In the event of a spill, it is important to take appropriate action to ensure the safety of individuals and the environment. The procedure for cleaning up a spill will depend on the size of the spill and the chemicals involved. For small spills, 1 liter, if possible, stop and contain/isolate the spill. Then proceed with cleaning up the spill if you are trained to do so. Contact your safety officer for further cleanup instructions if necessary. Safety officer will follow the biological and chemical spill cleanup procedure. For large spills, 1 liter, if possible, stop and contain/isolate the spill. Evacuate the area if necessary. Contact your safety officer for further instructions. Your safety officer will follow the biological and chemical spill cleanup procedure for further containment and cleanup instructions. In the event of an emergency involving cryogenic liquids or compressed gases, it is crucial to take immediate action to ensure the safety of individuals in the lab and the building. If an oxygen sensor is alarming with an oxygen level below 20.1% or there is a failure of any lines resulting in an uncontrolled leak of liquid nitrogen or other compressed gas, evacuate yourself and all others from the lab immediately, use the alarm system at the front of the lab, and alert anyone in the interior rooms at the front of the lab. Once safely outside the lab, pull the fire alarm for the building and make sure that your safety officer and the site manager are alerted. In the event of an explosion, it is important to take immediate action to ensure the safety of individuals in the building. If further explosions are possible, take cover by crawling under a table or desk for protection from flying glass and debris. Remain inside the building until it is safe to exit. Upon exiting the facility, proceed to the evacuation assembly area and report to your safety officer. As soon as possible, report the following information to the safety officer and/or call 911: location of the explosion, materials involved in the explosion, if known, and a description of the situation. If you are inside during an earthquake, stay there and take cover under a sturdy table or desk. Keep away from windows, shelves, or anything that could fall over. Cover your head with your arms to help protect against falling objects. Do not run or panic or go outside during the shaking. Wait for the shaking to stop before attempting to evacuate. If instructed to do so, evacuate the building if there is smoke or fire present, or if the fire or sprinkler alarm is activated. If you do evacuate, be aware of significant amount of fallen objects, glass or window breakage, and cracks in walls or floors. Follow the evacuation plan and listen to the instruction of the emergency personnel. If you find yourself in an active threat or shooter situation, the first thing you should do is contact 911 and wait for emergency response. Your safety is the top priority, so it is essential to follow the guidance of the authorities. If you find yourself in an active threat or shooter situation, the first thing you should do is contact 911 and wait for emergency response. Your safety is the top priority, so it is essential to follow the guidance of the authorities. Workplace violence is a serious issue that can have devastating consequences for employees, employers, and the affected workplace as a whole. There are several different types of workplace violence, including criminal intent by a stranger, customer or client violence, and coworker violence. Criminal intent by a stranger: the assailant in this type of violence has no legitimate business relationship to the workplace and usually enters the affected workplace to commit a robbery or other criminal act. This type of violence can occur in any workplace and is often characterized by the use of weapons and a lack of warning. Customer or client violence: the assailant in this type of violence is either the recipient of or the object of a service provided by the affected workplace. Coworker violence: the assailant in this type of violence has an employment-related involvement with the workplace. This type of violence involves a threat of violence or a physical act of violence, resulting in fatal or non-fatal injury to an employee of the affected workplace by a current or former employee, supervisor or manager, or other person who has a dispute with an employee of the affected workplace. If faced with a threatening situation outside the facility, get in your car and lock the doors or go back in the facility. Do not become confrontational. Remain calm and do not engage with the person or persons who are acting in a threatening manner. If faced with a threatening situation inside the facility, make every attempt to conceal yourself and/or take cover behind the most solid object you can find, i.e., desk, cabinet. Do not become confrontational. If the person's behavior becomes aggressive or inappropriate, call 911 if it is safe to do so. Leave the line open so the police can listen to what is taking place. If a person enters your work area with a weapon, immediately seek cover under your desk or work area and call 911 if you can. Do not try to confront the person or take the weapon from them. If you hear of or see an incident outside of the building, do not go outside. Contact your safety officer or 911 if the situation warrants and give your name and location. Find a safe place to hide. Stay in the safe location until you receive further instructions or until the situation is resolved. In the event of a fire, it is important to remain calm and take immediate action to protect yourself and others. Do not attempt to save possessions at the risk of personal injury. Instead, proceed to the safest exit. If you are the last to leave, close doors behind you to confine the fire, but do not lock them. If an area is smoky, stay low to the ground. Crawl if necessary. Assume smoke and/or fumes are hazardous. Use the back of your hand to feel the upper, lower, and middle parts of closed doors. If the door is hot or smoke is visible, do not open the door. Look for another way out. If the door is cool, brace yourself against it and open slowly. Proceed to your assigned evacuation assembly area and report to safety officer. Once you are safe, do not re-enter the building until you have been given the all clear by the appropriate authorities. Should you fight a fire? It depends on the size and intensity of the fire, as well as your own level of training and experience. If the fire is small and in its early stages, and you are trained and equipped to do so, you may be able to tackle it on your own. However, it's always important to assess the situation and make sure that it is safe to do so. Steps to tackle a fire in its early stages. Make sure the fire is small. The flames should never be taller than you and should not cover an area that is bigger than 60 square feet. Make sure that the fire isn't obstructed and that you can reach it from a normal standing position. In other words, don't try to put out a fire that's coming from a hole in the wall or from the ceiling. Observe the smoke. Do not attempt to put out the fire if the room is filled with smoke. Smoke inhalation can cause you to pass out before you finish the job. Check the radiant heat. If the fire is too hot for you to get within 10 to 15 feet, evacuate immediately. It's important to remember that firefighting is a dangerous task, and it's always best to evacuate the building and call the fire department if you are unsure about your ability to put out the fire safely. If you need to use a fire extinguisher for escape purposes, it's important to follow these guidelines. Stand at least 6 to 8 feet from the fire. Remember the acronym PASS. P. Pull the pin on the extinguisher. A. Aim the nozzle at the base of the fire. S. Squeeze the handle to release the extinguishing agent. S. Sweep the nozzle back and forth at the base of the fire. In the event of an injury or illness in the workplace, it's important to take immediate action to ensure the safety and well-being of the affected individual, as well as those around them. Step 1. Assess the injury or illness. Life-threatening injuries, unconsciousness, unresponsiveness, not breathing, severe bleeding, chest pain, shortness of breath, severe back, neck, or head injury, broken bones, exposure to highly toxic chemicals, severe bleeding, severe pain, or when the affected person requests emergency medical care, etc. Call 911 and follow the directions given by the 911 operator. Minor injuries, beyond first aid treatment, include muscle strains and sprains, minor lacerations, bruises, skin irritations, minor chemical exposures, debris in eyes, cuts, needle stick injuries, etc. Make arrangements with a safety officer to escort the individual to a clinic or hospital. Note: please do not allow an injured individual to drive themselves to a clinic or hospital. First aid treatment, including the application of bandages, cleaning, flushing, or soaking wounds on the surface of the skin, cold/heat packs, eye flushing, non-prescription medicine, removal of splinters, etc. Notify a safety officer as soon as possible. Step 2. Complete an injury report within 24 hours. Complete an injury report with your safety officer as soon as possible. This report should include detailed information about the injury or illness, including the date, time, location, and a description of the incident, as well as any relevant medical information. In the event of an injury or illness in the workplace, it's important to take immediate action to ensure the safety and well-being of the affected individual, as well as those around them. Step 1. Assess the injury or illness. Life-threatening injuries, unconsciousness, unresponsiveness, not breathing, severe bleeding, chest pain, shortness of breath, severe back, neck, or head injury, broken bones, exposure to highly toxic chemicals, severe bleeding, severe pain, or when the affected person requests emergency medical care, etc. Call 911 and follow the directions given by the 911 operator. Minor injuries, beyond first aid treatment, include muscle strains and sprains, minor lacerations, bruises, skin irritations, minor chemical exposures, debris in eyes, cuts, needle stick injuries, etc. Make arrangements with a safety officer to escort the individual to a clinic or hospital. Note: please do not allow an injured individual to drive themselves to a clinic or hospital. First aid treatment, including the application of bandages, cleaning, flushing, or soaking wounds on the surface of the skin, cold/heat packs, eye flushing, non-prescription medicine, removal of splinters, etc. Notify a safety officer as soon as possible. Step 2. Complete an injury report within 24 hours. Complete an injury report with your safety officer as soon as possible. This report should include detailed information about the injury or illness, including the date, time, location, and a description of the incident, as well as any relevant medical information. Thank you for taking this training. To complete the training and ensure you receive credit, please complete the quiz.